Hello and welcome to the multi-level health information modeling tutorial series.
In this section, we are going to address the issue of the temporal complexity of healthcare information. We will start showing this picture, and it is the picture of a hospital in the 17th century. As you can see, this hospital is very different from what we have nowadays. It was a place usually for poor people to be taken when they were severely ill, and they would be left there to die most of the time, and the nuns will be there giving them basic care and praying for them. If we have this moment to make this very anachronic exercise and think about an electronic health record being deployed for this hospital, I think it is very clear that the concepts that would be recorded for those patients will be completely different from what we would like to have in our modern electronic health records now. And this is so because the concepts for healthcare in this period of time, they were completely different from the concepts that we have nowadays. And here we are talking about a pre-modern age of the medicine. And the same thing if you advance another century and you go to the 18th century. This is a mental hospital in the 18th century. And what you can see here is more or less the same thing. Pre-scientific medicine and how the patients were treated. It was much more a place for the people with mental diseases to be left there and abandoned and just separated from the society. But something interesting is that we don't have too much difference in time as far as the incorporation of technology, but needless to say that first hospital that would take care of physically ill patients and this hospital that would take care of mentally ill patients, they would be dealing with very different concepts of what's disease or what's disease for those patients and what's the information that is important to be collected. So this is not specifically related to the temporal complexity, but the case mixes of those two hospitals will be so different, just to show that all this complexity can't be separated. The parts of this complexity can't be separated one from each other. They are all connected together, and they all interfere on the complexity of healthcare systems and how the information is collected for electronic health records. And then we can advance to a moment that we can start to regard as part of the scientific medicine. This is a hospital in the 19th century, and you can see that there's something interesting happening here, because the doctors, some of the healthcare professionals, are doing something that didn't make any sense in the other two examples that were shown before. They are washing their hands. And I don't know if this specific picture was painted before or after the Pasteur Revolution. I don't know if they were doing that because they were aware of the existence of microorganisms, but for some reason they started to understand by empirical evidence that it was important to wash their hands before they would touch a patient. Needless to say that here the concepts that would be important to be recorded about those encounters with the patients would be completely different from what we have seen before. And you have another technology being incorporated in this picture, because there is a lady in the right corner, and she was cleaning the ward. All those concepts are new concepts. This idea of having the hospital as a clean place, this is something that only became important in very recent times in our society. But there's something interesting about this picture, is that this is in the 19th century, but if you look at the lower part of the picture, the record of this patient is still pretty much the same that we still see in many hospitals across the globe. It is a piece of paper connected to the foot of the bed, and this is something that we should just stop and think for a while. How can hospitals evolve so much? And let's just look at this other hospital in the 1920s. And look at the amount of technology that was incorporated from the half of the 19th century, in 70 years, from the half of the 19th century to 1920. And a microscope wouldn't be conceivable. It wasn't existent in the 19th century. But here there is a researcher looking at something in this laboratory part of the hospital, and everybody's so concerned about cleanliness and the access to water and heating and everything that is necessary to be sure that the hospital is an environment that is free of bacteria, and so as you can see, this is a huge difference in the amount of concepts that were incorporated in this way to do healthcare compared to what we had before, and how many concepts were abandoned from what we had in the 70s and 80s and 19th century compared to what we started to have in the beginning of the 20th century. So if you have one of those century hospitals, like I was showing before in the other section about the Holy House in São Paulo, it would be the same place, but the concepts that would be recorded across the centuries would be so different. But still, that information should be collected at that specific moment in time with the concepts that were prevailing in that moment of medicine. And then imagine that you have a person being born in this hospital in 1920, and then when this person is an adult, he or she comes back to be treated here. Okay, so this is another hospital in 1955, and so you can say that a person was born in that hospital in 1920, and then this person comes back here to be treated in 1955, and look at the amount of technology that was implemented in this hospital and how those concepts were evolved over this short period of time if you compare to the centuries that the changes were necessary before. And how many concepts that were valid in the 1920s are not valid anymore because things evolved so much. And then imagine that the same person now is older and is going through an orthopedic surgery in this case, and this is a hospital in the 1980s. Look at the amount of technology that you have incorporated now in the surgical ward, and you start to see, as you can see in the lower part of this picture, you start to have hardware and software embedded being used to collect data from those patients. It is the same patient in the hospital in the 1920s, in the hospital in the 1955, and in the 1980s. Of course, the concepts evolved so much, so if we could still be anachronic and think about electronic health record for this specific place, and this specific hospital is recording this information about this patient in the 1920s and 1955 and 1980s, how different those health records would be as far as the concepts that are evolving all the time. But that doesn't mean that information that was collected in the 1920s about this patient would not be important and shouldn't be kept in a longitudinal record. And then here we are, 2012, and almost everything in medicine is so full of hardware and software, and this is what we think about, a modern hospital nowadays. And all those hardwares are collecting data from those patients, and what happens is that this data is just scrolled off from the memory of those devices when the memory is full of data, and that will keep going on and on. And then let's think about the future. This is a picture that is from Star Trek, and how in the 50s medicine in this very evolved society would be done. Of course, they were very creative, but if you compare to a modern hospital, you can see that they were modest as far as imagining how that could be, because of course you have a lot of hardware and of course a lot of software embedded, but our reality today is much more complex than what they were able to think in the 50s. So this is important, that even centuries in the future, the information that we are collecting now will still be important for predictions and time trend analysis, but this information will have its specific temporal context that should be kept in time. And just zooming in, for looking at an individual, the temporal complexity gives respect to each individual, because when you're a baby, your profile as a patient is completely different from when you are an adult. Because when you were a baby, you don't need to be concerned about reproductive medicine or occupational medicine. Those things won't be part of your health record. And when you are an adult, and then you don't need to be so concerned about the collecting vaccination data, because that won't be as frequent as it was when you were a baby. But of course, if something happens to you here when you were an adult, maybe some information about what happened to you when you were a baby was important to define what will be your treatment and your prognosis now that you are an adult. And then you keep moving on, and when we are older, the same thing. Maybe we don't need to be so concerned about reproductive and occupational medicine, but then we'll have another concerns about our health, comorbidities and chronic conditions. But even then, what happened to us when we were babies and when we were adults is still important to define several outcomes of what's going on to us when we are older. So the temporal complexity can't be, again, the same thing as the spatial complexity, can't be understood at any zoom level, from the individual to the hospital system, or for the entire healthcare system of a given geographic area.